So, I am Krishia Mangantulao and I am your student nurse for today. So, how are you?
I'm doing fine.
That's good to hear. So, just to confirm, you are Sian Cabaral, 19 years old from Quirino.
Yes.
And I am here today and I'll be doing an assessment of your head to neck. The purpose in doing this is to assess whether there are any underlying issues or health problems. So before anything else, I will first close the door for the client's privacy. And sir, may you please give me a minute to prepare my equipments and do the hand hygiene?
Yes.
And now I'm ready to assess the head and face of the client. The size and shape of the head of the client vary in accord with ethnicity. The head is round in appearance, and to check for the symmetry of the face of the client, sir, can you please frown, smile, and puff out your cheeks? So, the head of the client is symmetric and appropriate with the body size. And now I'm gonna palpate the head. The head of the client is hard and smooth without any lesions. And now I'm gonna palpate the temporal artery to check for any inflammations. So the temporal artery of the patient is elastic and not tender. And now I'm going to palpate the temporomandibular joint of the patient. And to do this, sir, can you please open and close your mouth? So the mouth closes and open. The mouth closes and open fully, and the jaw moves laterally 1 to 2 centimeter in each direction. So now I am done in assessing your head and face. And now I'll be assessing the neck of the client. The neck of the client is symmetric with head centered and no bulging masses. Then next, I'm gonna inspect the movement of the neck structure. And to do this, sir, can you please take a sip of a little water? As I have observed, the thyroid and cricoid moves upward symmetrically. Then next, I'm gonna inspect the cervical vertebrae of the client. Sir, can you please look down? The 7 cervical vertebrae of the client is visible and palpable. Then next, I'm gonna inspect the range of motion. And to do this, sir, can you please face to the right and to the left? Then look down and tilt your head backward. Then your ears touching your right shoulder. Then the other side. So as I have observed, the neck movement of the client is smooth and controlled. Then next, I'm gonna palpate the trachea, but first I'm gonna identify the jugular notch. As I have palpated, the trachea is in midline. And now I'm gonna palpate the thyroid gland. The landmarks are positioned midline. And sir, can you please swallow? The glandular thyroid tissue is felt rising underneath my fingers and the lobes as well. Then next, I'm gonna auscultate the thyroid gland. Upon auscultating, I didn't hear, and there are no Browitz. So now I'll be assessing the lymph nodes of the client. The preauricular, the posterior auricular, the occipital, the submental, the submandibular, the tonsillar, the superficial cervical, the deep cervical, the posterior cervical, and the supraclavicular. Sir, did you feel any pain when I'm palpating your lymph nodes?
No.
So, as the client reported, he didn't feel any pain while I'm palpating the lymph nodes. And now, I'll be assessing the visual acuity of the client by letting him read the Snellen chart. So, sir, can you please read what I will be pointing out?
P, FP, TOZ, LPED, PECFD, EDFCZP, FELOPZD, DEFPOTEC.
Then now cover your left eye. And read this one, sir.
E, FP, TOZ, LPED, PECFD, EDFCZP, FELOPZD, DEFPOTEC.
Then cover your right eye this time.
E, FP, TOZ, LPED, PECFD, EDFCZP, FELOPZD, DEFPOTEC.
So this means that the client can read in 20 feet distance. Now I'm gonna perform the near visual acuity of the client by letting him read this Rosenbaum. Sir, can you please read the first stanza at 4 inches?
Hence, it is almost a definition of a gentleman to say he is one who never inflicts refined, and as far as it goes, accurate. He is mainly occupied
The next paragraph.
in merely removing the obstacles which unembarrass actions of those about him, and he concurs with their movements rather than take the initiative himself. His benefits
The next.
may be considered as parallel to what are called comforts or conveniences in arrangements of a personal nature and fatigue, though nature provides both means of rest and animal heat without them. The true gentleman, in like manner, carefully avoids whatever may cause a jar or a jolt in the minds of those with whom he is cast all clashing of opinion or collision of resentment. His great concern being to make everyone at his case and at home.
So, thank you, sir. The near visual acuity of the patient is normal because he can read clearly and completely each paragraph. I'm gonna test for the peripheral vision of the client. So, sir, can you please look at the object that I am holding and raise your hand if you already see it, starting on the inferior side. On the superior side. On the temporal side. And please cover your left eye. So the client has normal peripheral vision because he saw the object that I am holding on the inferior side at 70-degree angle, on the superior side at 50-degree angle, on the temporal side at 90-degree, and on the nasal angle at 60-degree. I will perform the corneal light reflex by shining a light on the bridge of the nose of the client. So as I have observed, the reflection of light on both eyes of the client is at the same spot. And now I'm gonna inspect the eyelids and eyelashes of the client. So as I have observed, the upper lid is between the iris and the pupil. The lower lid is rested on the lower border of the iris. And next, I'm gonna assess the ability of the eyelids to close. Sorry to do this, can you please close your eyes? So the eyelids closes completely and easily. And now I'm gonna assess the position of the eyelid in comparison with the eyeball. The lower lid is upright, no inward and upward turning, and the eyelashes are evenly distributed. Now I'm gonna observe the eyelids. And as I can see, there is no redness, no swelling, and free from lesions. And now I'm gonna observe the position and alignment of the eyeballs to the eye socket. So the eyeballs are symmetrically aligned with the eye socket. Okay nga. And now I'm gonna inspect the bulbar conjunctiva and the sclera. And to do this, sir, can you please move your eyes to the left and to the right, up to the ceiling. So the bulbar conjunctiva of the client is clear, moist, and smooth. And the sclera is white. Then next, I'm gonna inspect the palpebral conjunctiva of the client. So the palpebral conjunctiva of the client is clear and free from swelling. And to further assess the palpebral conjunctiva, I'm gonna invert the eye. So as I have observed, it is free from lesions, no foreign bodies, and free from trauma. We palpate the lacrimal apparatus of the client. So as I have palpated, there is no drainage noted. I'm gonna inspect the cornea and lens. So as I can see, the cornea is transparent, smooth and free from and no opacities, as well as the lens. And now I'm gonna test for the pupillary light reflex and the consensual response of the pupil. So the response is constant. I'll now be assessing the nose of the client. So first, I will inspect and palpate the external nose. Do you feel anything, sir?
No.
So the nose of the client is fairly symmetrical. No signs of deformities and no lesions. The color of the nose is same as the color of the face. So next, I will check for the patency of air flows through the nostril. So to do this, sir, can you please cover your left nostril? Breathe in, breathe out. Then cover the right. Breathe in, breathe out. So the client is able to sniff through each nostril while the other is occluded. And now I'll be inspecting the internal nose of the client by using a pen light. To do this, sir, can you please tilt your head backward? The nasal mucosa of the client is dark pink, moist, and free of exudate. The nasal septum of the client is free of lesions and intact. No, free of ulcers and intact. The turbinates of the client are dark pink, moist, and free of lesions. Now, I'll be assessing the sinuses of the patient. First, I will palpate the frontal and maxillary sinuses. Sir, do you feel any pain?
No.
Upon palpating the frontal and maxillary sinuses of the patient, there is no tenderness. Then next, I will percuss the frontal and maxillary sinuses of the patient. Sir, do you feel any pain?
No.
Upon percussing the frontal and maxillary sinuses of the patient, there is no tenderness.